welcome to Virtua Health's Real Talk Women's Health Chat. I'm Bridget Reuter from the Virtua Health marketing team, and we are so grateful to have so many of you joining us tonight. Before I introduce our speakers, we do have a couple of quick reminders. Your camera and microphone are disabled, but you can still interact with our panelists at any point by typing your questions into the Q&A tab at the bottom of your screen. If you'd like to submit your questions anonymously, just click on anonymous before sending in your question. Many people have already submitted fantastic questions, and we will be incorporating those into our discussion. So thank you again, and let's jump into it. Our discussion tonight is about digestive health. So full disclosure warning, this is real talk. We are going to get into all of the bathroom issues. It wouldn't be real talk if we didn't. And we have two wonderful Virtua Health experts to guide us through. We have gastroenterologist Dr. Theresa DiSandro and registered dietitian Christy Davidson. Dr. DiSandro has been practicing in South Jersey for 12 years and has an expertise in women's GI health and colon cancer prevention. She's also the mother of two. Her son is 3 and her daughter is 17 months. Christy Davidson has been a registered dietitian for almost 20 years with experience in medical nutrition therapy. She is passionate about helping people to improve their overall health through nutrition. Christy is also a busy mom of 3. She has 2 daughters, ages 7 and 13, and right in the middle is her son, who is 11. So you both have very busy homes. Thank you so much, Dr. DiSandro and Christy, for joining us. I just want to check and make sure your mic's
working. Thank you for having us.
Yeah, absolutely.
Thank you.
So welcome, everyone. A night away from the kids?
Hiding from the kids, I should say.
Yes, I agree.
I can definitely relate. Mine are a little older, but I'm like, please keep the dog away from my door. So let's jump into this and talk about these digestive and gut health issues. Is it true that it's more common for women to have digestive issues, or are we just more comfortable talking about it?
Absolutely. It's interesting that you bring that up, because in general, females do tend to seek help and tend to go to the doctor's office to get their GI issues evaluated. But interestingly enough, that is not the case. That's not the reason we see it. There are major differences as a result of hormones, our physical makeup, and the result of pregnancy and childbirth and how it affects our bodies. There are some permanent lasting effects. So it's part of why our bodies aren't the same when we were 15 than now in our 40s. Female hormones have a significant effect on our bodies, which is why during our menstrual cycles, we commonly have bloating and fluid retention and constipation and slow digestion during those times. Also why our bowels change during pregnancy. An interesting fact is, though, and I don't quite understand why this would be the case, is the female colon is 10 centimeters longer than a man's colon. And what that does is, because we tend to have a smaller pelvic frame, it ends up having the bowels sitting in our pelvis, where it is competing for prime real estate with our reproductive organs. So that does also make us more prone to digestive issues for that reason, just our general makeup.
Okay. Go ahead.
No, go ahead.
Go ahead. Are there ways? What can we do about that? Is there, obviously, I think we all just get used to kind of coping with those monthly cycles, and probably we'll get to that later, probably why we may dismiss symptoms that we maybe shouldn't dismiss because we're used to coping with them. But is there anything we can do as women? Is that?
Absolutely. And I think one thing is understanding what's normal physiology and how we can deal with it. And sometimes it is a matter of just modifying our diet and adjusting what we're taking in, knowing that there are certain triggers that can exacerbate that hypersensitivity because of the hormonal influences we have. And I'm sure Christy will get into a lot of that, some of the triggers.
Well, let's talk about IBS, because I think that's one that we hear a lot. Women talk about IBS and seems to be associated with women a little bit more. Are there different types of IBS, and how do we know if that's what we have?
So that's a good question. More often, IBS is actually a problem with the sensitivity, our visceral hypersensitivity. So we are more aware of distension, whether it's with stool or fluid or even gas itself. In general, females tend to have greater rectal sensitivity, so we tend to be more aware, but it is part of the pathophysiology of why IBS is a problem. Slower colonic transit is also part of the problem, which is, again, a normal phenomenon for us, but it tends to be exacerbated. There are three main types of IBS, or irritable bowel: diarrhea predominant, constipation predominant, and a mix of both. Sometimes, we can be on two opposite ends of the spectrum, even with those things that we would expect, like hormonal influences that might slow things down, but it can actually also give us some of those symptoms of fecal urgency, where we feel like we have to rush to the bathroom after a meal or during a stressful time.
Okay, so what can we do about that? Christy, is there, if it's a sensitivity, is it often food related? It seems like stress is a trigger for some of those irritable bowel symptoms that you were describing. Is there anything that, we should be thinking about to manage on our own?
Right. There's definitely lots of factors involved. So it's trying to find that root cause or some of the major factors that are involved in this. So yes, it could be hormonal, it could be stress. And if that's the potential trigger for it, learning to cope and stress with those. As far as diet, okay, which one is it? Is it constipation? Is it diarrhea? Is it a mix? And there is becoming more and more research out there. So that's the plus side. So a lot of people have found beneficial effects if they start off with wiping the slate clean and following a low FODMAP diet, trying to get to the root cause. And I can get more into what the low FODMAP diet is, but basically FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are food components that are restricted in this diet because they tend to intensify these symptoms. So basically, we go and avoid those foods for anywhere between 2 and 6 weeks. That's where we're wiping the slate clean, sticking to things that are better tolerated. And then is phase 2, where we now reintroduce and get a really customized tolerance for each individual, because everyone's different. Being that it is a restrictive diet, I don't recommend that you try it on your own. It may sound easy enough to research this and look up the app for low FODMAP diet, but that's only a small part of it. We don't want you to then lead to any vitamin, mineral, protein deficiencies because you're following something you looked up online. So definitely working with your physician as well as a dietitian. Pairing that too, and you're a key component of it. No one knows your body like yourself. So a whole component of doing something like that is also then keeping a food diary as well as a symptom tracker. With that, having your rating system, okay, when you introduce a new food, how is it? Are you just a little bloated, or is it, no, I can't handle that food? And then what portion size? So it's a really combined effort working with your GI physician, the dietitian, and then coming prepared and following the restrictions during that time for IBS. So it really depends on your symptoms with how we manage that. Yes, we can to increase fiber for some, but it depends, and don't go 0 to 100 with fiber. I always encourage that. No, it's not that way. It's slowly building up your tolerance, because if you increase fiber too quickly, you'll have bloating and more
And
constipation.
that's one of my questions for sure. So let's talk about bloating, because we're supposed to eat the high fiber, right? And
Yep.
but I've tried to take fiber supplements and that just did not work for me. So what is your advice there around bloating? Because and it sounds like what you're saying is there's a difference between like, I don't really like the way my belly looks and like, I have to get these pants off. I'm so uncomfortable bloating.
Yes, so it's definitely expressing these symptoms to your doctor. Also, the frequency. Okay, if you're having diarrhea, well, how often? And get very personal. Okay, what is the consistency? Is it water-like? Is it foul-smelling? We need to know. Your doctor needs to know this. Okay, it's very key. And then too, people laugh. I'm like, no, what is the consistency? Not to ruin soft serve ice cream for people, but kind of how it should look. So just getting personal. And as far as the bloating, it's yes, we need to identify if it's a food trigger, then we can adjust that and help modify your diet. What may work for one person may be fine increasing the fiber, but it's not a one fits all solution.
Okay, so then pros and cons, things like, adding the beans and lentils and, they can be rough on the digestive system, right? Or even
correct. So beans and lentils, as long as you're not bloated from them and you can tolerate them, wonderful. But if you're having this bloating and don't know the root cause, that's part of the avoiding them during this 2 to 6 week process if you are to start a low FODMAP diet. And then finding that right balance, how much can you digest and absorb too, with those sometimes cooking them opposed to making sure they're softer. They'll still have some fiber in that, but just making them better tolerated for you can help. Does that answer your question?
Yeah, so how about, I know I'm going down this pathway, but like, what about like the digestive enzymes, right? They set things like Beano, and is that recommended? Is that okay to take those?
And I'll let Dr. DiSandro answer that as well. But yes, it can help minimize some of the symptoms, but we also want to, in my opinion, is we want to make sure we're not putting a Band-Aid on a larger issue.
And that is typically what people will do. They'll come in and say, oh, I went to GNC and I tried these digestive enzymes and pancreatic enzymes. And a lot of those things aren't without side effects and risks. So if you don't truly have a malabsorption problem of fats, pancreatic enzymes or taking additional pancreatic enzymes might not be the best thing for you. You may not have a fat malabsorption issue. And I think that's part of why, like, as Christy said, people are just putting Band-Aids on things. And with irritable bowel, sometimes some of those foods, if you are able to follow a FODMAP diet in an isolated plan, working with a nutritionist, irritable bowel is something that's cyclical. It's not something, it's in its extreme phases. If we're not getting down to the root cause, yes, you'll feel it day to day, but it's typically one of those things that waxes and wanes. So sometimes it's a matter of when the symptoms are peaking or when you do feel that bloating where you look 9 months pregnant, that's when you follow a stricter FODMAP diet. So that, as Christy said, you're not depriving yourself of vitamins and minerals and important nutrients that are then going to lead to other problems and other symptoms. And then it's just a vicious cycle. So
I just want to clarify for those who are not familiar, FODMAP, it's FODMAP, right? All one word.
Mm-hmm.
So if you do want to look that up, learn a little more about that, but the recommendation is to talk to your doctor, right? To not try to head down that path on your own.
Exactly. And even with the supplements going out, a lot of those are not a regulated industry. So it may say it has this or it's good for that, but typically, unless a lot of people have had ill side effects, a particular product won't be looked into. So when you are looking for a vitamin or mineral or herbal supplement, you're looking for a reputable product. Also review them with your physician to make sure that they're not going to interfere with any other medications that you might be taking.
Sure. And I know there's certain foods that do tend, like carbonated drinks can, coffee even sometimes, right? Too much caffeine. There are things that can add to or exacerbate the, if you tend to have bloating issues.
Exactly. And caffeine's a stimulant. So for those of you who might be having some diarrhea and then going and having a caffeinated beverage, it's going to put it even more in hyperdrive. So exactly.
Yeah, and I typically have patients that say that they're constipated and that they'll make sure they have that full morning coffee just to try to stimulate a bowel movement. So yes, definitely caffeine is a major stimulant. The other thing that we don't realize too is chewing gums and candies. I mean, those sugarless substitutes are actually not absorbed by our GI tract. So they induce a laxative effect too. So sometimes that could be a factor or trigger.
For diarrhea.
Yeah,
And
or even bloating.
And abdominal discomfort. Those sugar alcohols, they tend to end in OL, not all of them, but most of them. So that's a little bit easier way to spot them. They're put in a lot of things to make them sugar-free, to make them palatable, but yet sugar-free. And everyone's tolerance is different. So definitely read the ingredients. If it says low carb, flip it over and look at the ingredients. They now are required to start putting them on the food label themselves, but regardless, they will be in the ingredients.
So can you just say that one more time? Things with the OL, like xylitol, what are some of those?
Yep, xylitol, erythritol, maltitol. Those are all examples of sugar alcohols.
Okay, so if you're having an issue, that could be possibly if you're having a lot of like sugar-free or diet drinks or even chewing gum. I didn't realize that, right? A lot of people use
correct. It could be in that. It could be it could be in some candies. There's a new one out there, Hershey Zero. But it says same great taste, new packaging, doesn't contain aspartame, but you flip it over and look at the ingredients. The very first ingredient is a sugar alcohol, not even cocoa. So, and it does have a disclaimer that it can cause GI upset on the back of the package. So we definitely want to be aware of what we're consuming. Not that these things are necessarily bad, but moderation. And we want to be aware of how much we're consuming. And if we're having these symptoms, that's time to do a deeper dive. Funny story real quick. My husband went out and he comes home to the kitchen, puts this drink down. He's like, oh, this is my favorite drink. It's delicious. I'm drinking this all the time. And I'm looking at it. It says Body Armor. But he said he read it as Body Armor Life, but it was Body Armor Light, spelled Lyte. He's like, it's peach mango. I love it. I'm like, good luck with that. So my husband does landscaping and painting. So it was a very hot day one day. He had more than one. He was fine on the days he had one of those drinks. But by that third drink, he did not make it through the day. He was at home in the bathroom. He thought I was joking. So everyone's tolerance to these are different. I don't want to scare you and think that they're terrible, but it's just time to sometimes, if you're having GI symptoms, to look a little deeper into potential causes.
That's really interesting. I definitely wasn't aware of that one. But there's something you said, Dr. DiSandro, about having that cup of coffee in the morning. If you are, let's talk about constipation, right? Everyone's favorite topic, but something everybody deals with from time to time.
Yes.
Is women, I read women experience constipation 3 times more often than men.
Yes.
Right? Lucky us.
Yeah.
So can we let's kind of talk to that, get to the bottom of that, right? Mm-hmm. A little bit about chronic constipation in women. Is that?
And again, it lends to some degree to our normal physiology. There was actually a study where they looked at digestion in females compared to males. And at baseline, to digest food, it takes drastically longer for women as opposed to men. In one study, to digest food, it was 33 hours in a male as opposed to 47 hours in females. So we are already dealing with that. And now add constipation to the mix and we're really feeling it, right? So, and constipation itself, again, is a symptom. So the important thing though is to just gauge it. Is it a symptom or is it a complex of a problem that's going on for a period of time? So you may just get the constipation with your monthly cycle as a hormonal influence, but it can actually be something that's more long-term. And for it to really be a diagnosis, it's something that lasts at least for 3 months. And there's different causes of it. Again, is it a motility issue? Is it a neurologic problem with contractions? Is it slower transit of the GI tract? Is it normal transit, which is already slow at baseline? Or is it a problem with the outflow, with the mechanism? Having a bowel movement is the most complicated concerted dance. It's a flow of muscles contracting and relaxing and dropping and stretching all at the same time. And it's one nervous system doing it. So, I mean, it's a pretty complicated, again, I look at it as a dance. And if anything is off, even if the angle of the muscles are off by 5 degrees, it's going to cause constipation. So again, a number of factors. So sometimes it does involve working with your physician to determine, one, what type of constipation you have, and is it something that requires medications, and what do we reach for? Because depending on the type of constipation, not every laxative is the same. Not every medication is the same. Fiber's not going to work for you the same. You might need smaller snippets of doses versus spreading it out spatially or getting larger doses. So it is complicated, to say the least.
I love the way you describe it as a dance. That's why you're so good at what you do, right? Because you view this as a dance. The digestive tract and the way our system works. I love that analogy. Okay, so there's things. How do we know if it's a problem, right? Like I've had advice like you need to exercise more, right? Get out and walk and move the body. That's going to help with. So if you can maybe give us a couple of tips for if it's something you can manage on your own, and then how do we know when maybe we need some expert assistance?
So I would say that if it's lasting for more than a month, or if you haven't had a bowel movement for, say, within 7 days, it's starting to cause some discomfort, it's causing some nausea, or it may cause significant bloating or vomiting, there are more alarm symptoms where you need to seek help sooner rather than later. If it's just constipation that's periodic, where again, you're reaching for a laxative and it might work, then that's when you should come in and discuss, trying to tailor exactly what type of constipation we're dealing with so we know how to attack it. I always start with lifestyle changes. Like you said, exercise, drinking enough water, taking in enough fiber, all key. Making sure you have good digestive bacteria in your system, all important key baseline things that we can do that's actually feasible and manageable, and not, again, just reaching for an over-the-counter laxative that might be harmful to you if you take long-term by yourself. It's definitely important not to self-medicate.
What about like the xylitol and the caffeine and using that as a, can you use that as to help with the constipation?
Again, coffee in moderation, there are some benefits, and there's studies coming out to see, how is coffee helpful? There's been a study looking at it with fatty liver disease and cardiac disease. So a cup of coffee is not bad, but again, everything in moderation. A pot of coffee is much different than, to try to stimulate a bowel movement. Taking those sugars, the problem with that is, as Christy's husband experienced, it's very unstable. You don't know how you're going to respond, and it might cause that explosive diarrhea, which is then the extreme of what you don't want. So I wouldn't recommend using those sugar substitutes, because then you're dealing with the gas and the bloating and the distension that's just making you feel uncomfortable.
Yeah, I don't want that.
No.
Christy, anything to add there?
Sure. You want to also make sure that you're well hydrated. Okay, so in addition to exercise and being mindful of your portion size, hydration is very key. And then sometimes you might want to try even adding a little bit of ground flaxseed to your diet. That's a more natural way. It's usually a little bit easier to tolerate when you add that. And again, when trying something new, we always want to go slow. So it may say a tablespoon. No, let's start off with like a half a teaspoon or a teaspoon today. See how we do. Either skip the next day or go the next either every day or every other day and build up your tolerance to see how you respond. But flaxseed has good omega-3 fatty acids in it. If you do purchase it, consider keeping it in the refrigerator or the freezer to help preserve those omega-3 fatty acids, but they can be beneficial to help with the constipation.
I put it in our pancakes and
Yeah.
nobody knows.
That's why I encourage people too. Some people put it in their beverages and they drink it that way. That's fine if you like it that way.
It has a texture though.
Me personally, it's not the way I do it because I feel like it just suspends or sinks to the bottom and then you're trying to get that down. So it has a nutty flavor. Sometimes I'll sprinkle it over my salad. There's lots of different ways you can add it to what you're making. You can use it as a seasoning and not necessarily in your drink. So be creative and we can help you with that as well. Sometimes, like the doctor said as well, we want to do small, frequent meals. Okay, if our digestive tract is slower, we don't want to eat too much at once. So aiming for about 5 small meals may be more beneficial. And it depends on your motility. If you have a slower motility, then we need foods that are digested more rapidly to keep the system moving. So it's a lot of moving parts, exactly right. We have to put them all together and find the cause and really give you that individualized treatment that will work best for you.
Thank you. I think so many women suffer on their own with this. So to know that, you're both welcoming these conversations and really have these conversations every day. So to know that there's help and that you don't have to just struggle through this, I think that's going to make a big difference for a lot of people.
Yep.
One of the trends that we see a lot of people talking about right now is going more plant-based. Right, probably, for a lot of reasons, cutting out some of that meat and certainly processed food is better for our overall health. But how about going more plant-based for our digestive health?
Great question. So the whole plant-based movement, I think, has a lot of pluses as well as minuses you got to roll out. So yes, incorporating more plants into your diet, more whole foods is the key, not necessarily processed plant products. Because when they're processed, they tend to have extra additives and things that may not be well tolerated. And yes, plant-based is great for digestion, good vitamins, good nutrients in there. It helps keep your, those who have consumed more plant-based diets have shown to have more healthy bacteria in their intestines. There's a lot going on now with the gut microbiome. We want to keep that healthy, keep things moving along. So definitely incorporating more fresh fruits and vegetables into your diet. And then if you do have any bloating when you do this, again, that's when it's time to seek help and to get that personalized plan for you.
How about Dr. DiSandro, can you talk a little bit about like cancer risk and red meats and kind of the reason to maybe cut some of those out of your daily or your weekly diet?
Yeah, and I have to tell you, there's been a focus looking at nutrition and is it a trigger? As you know, colorectal cancer, we've been seeing it's one of the cancers where we're actually seeing a higher incidence in younger patients. And we do believe that maybe it has something to do with the processed foods, the way we're eating, because our parents and grandparents maybe ate healthier foods. But we're seeing more and more processed foods that might be the problem. Red meats have definitely been cited as a problem. Eating more than 2 servings a week has actually been shown to promote polyp formation. And 99% of all colon cancer arises from a colon polyp, which is a completely benign asymptomatic process. We don't know when we have them if we have them. So the idea is to try, yes, to eat healthy. Fiber has been shown to actually decrease the incidence of polyps and colon cancer. So again, we're focusing on, fiber helping not only things like IBS, but yes, cancer prevention, which is key and very important. They're also looking at, there are some recent studies looking at calcium and vitamin D, and some preliminary studies have actually shown that diets higher in vitamin D and supplementation have actually been shown to decrease the incidence of colon cancer. Again, we'll have to see bigger studies to confirm this, but I mean, that's amazing data. And that's key because so many people, especially in the US, are deficient in vitamin D. I mean, the numbers, I think, as high as almost 40%, especially in the winter months.
So do you not recommend dairy-free necessarily? You think?
So yes and no. I think if dairy or lactose is your problem, then yes, supplementation is better. Of course, we always prefer getting our nutrients and minerals in with food as a food source, because the foods that are rich in those things actually do have, are rich. And it's funny, when I looked at the study that looked at vitamin D, to get the amount, it was the equivalent, the study where it showed a benefit was about 3 glasses of milk. I'm pretty sure it's very difficult, even for someone who's not lactose intolerant, to be able to tolerate 3 glasses of milk. So again, a lot of foods are enriched with vitamin D, and maybe that's where we add the supplement, where it might help us.
Christy, I bet you have a whole list of vitamin D, high vitamin D.
Yeah, like definitely a lot of your foods are fortified with vitamin D. Yes, they're in dairy too, okay. But it all depends. The supplements do help. Different things you can do. Yes, sunlight is good in the summer, but you can't always do that in the winter. So it depends too. We also want to make sure if you do have a vitamin D deficiency that there's not something else going on, that your body is just not activating the vitamin D, so it can be absorbed as well. And vitamin D and calcium work together for your bone health overall, so it's very key. So calcium-rich foods are good for vitamin D. A lot of your greens are fortified as well. So there's different products out there, okay, incorporating some animal sources, but yet, okay, we don't need to go for red meat. Limiting that red meat to no more than once a week is what I typically tell patients is fine. And then just like we said, just improving your gut microbiome, because as you do that too, there was a recent study that I looked at, was pretty interesting. They basically wiped out the intestinal bacteria in patients, and they found that patients who do consume more plant-based foods were able to rebound a lot faster. So with a lot of the different, and the doctors can speak to that as well, antibiotics out there, we're becoming more and more resistant. So it's even more reason now to get back to where our ancestors and maybe grandparents used to be, by having less processed foods into our diet. So I just wanted to make sure we went back to that and touched on that as well.
I think that's an important point, though. It's plant-based is great, but also less processed, because a lot of what's being advertised now are sort of these like the Beyond Burgers and the Impossible Burger, right, which are highly processed meat alternatives, but they look and supposedly smell, and I don't know about taste, like beef. But in that case, you're sort of introducing a whole nother issue, right? If you're swapping out the red meat, then you're introducing in the highly processed food.
Right, and all that processed food, your body processes that differently than something natural. Your body absorbs processed foods completely different than something in its natural state. So you just want to kind of remember that as well. And I don't want to leave you without giving you your vitamin D sources. So mushrooms are good, your dairy. Fish is a great source of vitamin D. Orange juice tends to be fortified as well. So I didn't want to not leave everyone without that.
Good. You're good. She's on it.
And almond milk sometimes too, when it's fortified, could even have more than some of the other beverages out there.
Let's go back to some of the conversation about supplements and like prebiotics, probiotics. How do I know which one I need? And is there I know there's a lot of different options on the market. Whose favorite topic is this? Dr. DiSandro, do you recommend it to your patients?
So that's a good question, because prebiotics and probiotics are important for one reason. First, understanding the difference is really important. So probiotics is just giving back the bacteria to our GI tract. Studies have shown that patients that have, or if there's a specific species, in fact, if we're deficient in, it's actually induces inflammatory mediators to actually cause inflammation. And that's part of why people talk about that leaky gut. We don't have good tight junctions. It doesn't keep the integrity of the cells to help with absorption and digestion. So probiotics are very important. There are certain instances, though, where it may be difficult, and prebiotics are the same situation. So understanding the difference first, we can start there. So probiotics are the bacteria themselves. Prebiotics are actually, I look at it as the nutrition for the bacteria that you're already populated with. So, not knowing you have a good population, it's hard to say, oh, take prebiotics alone, because you don't really know what you're doing. What prebiotics are, they're basically nutrition for the bacteria. And most of them are FODMAP-rich nutrients, things that we don't digest. So, there's certain forms of oligosaccharides. The most basic form of prebiotics is in breast milk. It's that the human oligosaccharide milk. And that's what they actually enrich formula with, or try to mimic it to help babies sort of be able to populate with the good bacteria. So having a good, base and good nutrition helps, but we also have to add the probiotics. And again, which type you use matters. I know some people ask questions about refrigerated or not refrigerated. In what form you take them in as well. And I may need Christy to help me with some of this, but I tend to like the supplements because they do tend to have the most important bacteria we know is Bifidobacterium and Lactobacillus, or a combination of the two. Different variations of those species are the best. Refrigerated or not, it's hard to say. It's hard to get access to the refrigerated ones, which is why they don't refrigerate them. You want to make sure there's at least 1 billion organisms. And then the question becomes, is it good to get it in yogurt or not? Well, the problem with yogurt is things are pasteurized. So sometimes that kills off live cultures and bacteria. So sometimes yogurt's not the best way to get it. And plus, if you have a lactose issue, if that's one of your triggers, that's going to induce more symptoms and not necessarily replenish the bacteria. So you don't want to have diarrhea either, because when you do have diarrhea, you're going to lose some of that good bacteria. So I think it is a fine balance with that. And there are certain conditions where probiotics and prebiotics can actually be bad for you, and there's syndromes that overlap IBS that maybe have been undiagnosed, or, you were called IBS, but you maybe have some other conditions. So prebiotics are a problem with patients that have FODMAP issues. If you have malabsorption of those carbohydrates or lactose, it may actually make you worse. If you have a small intestinal bacterial overgrowth condition, the probiotics can actually exacerbate your symptoms and cause more diarrhea. So yes, they're important, but it's also important to make sure you don't have conditions where those things might make things worse.
Exactly right. And then finding the right probiotic, prebiotic, again, it's not necessarily a regulated issue. However, over the past 20 years, there's been a lot more research on probiotics themselves, where they are listing the specific species or strand used. So going for something like that, especially depending upon the condition, again, we have to say, why are we going for this probiotic or prebiotic? To see if it will be beneficial for you, what else is going on. And then if it is, we say, yes, go for that probiotic. We want to make sure that we get a reputable one that has a specific species or strand listed, and it will say it on the label. So how do you know if it has a specific strand listed? Well, it has some weird numbers and letters after it. So that's a quick way to know that, okay, this specific strand has been studied, or it's at least specified that this is a particular species. How do you store them? It honestly depends on which one you do get. So reading the package instructions on storage is also key.
So, okay, so I have so many questions. So you're not saying that you have to buy a certain strain of probiotic. You're just saying that if it has that identified on there, it's representative of a higher quality probiotic.
Correct.
Okay.
Yes.
Okay. And then it's also not so it's not something that just everyone should take. Like you should take a multivitamin and a probiotic. It sounds like that's not across the board. So what are some examples maybe of conditions where you would say, why don't you try a pro or a prebiotic?
So forms of IBS, depending on what's the cause. If it's simple IBS, then yes, that's a time when we may, reach for those probiotics. A key well-studied time is it's been shown if you've had a bout of bacterial enteritis or a norovirus case, where that stimulated some GI upset or symptoms. Naturally, when you're having that diarrhea and you're losing all that stool, again, you're losing your good bacteria. So that's a good time to take it. And studies have shown that can actually get your GI tract back to normal. About 30% of patients that actually have a bacterial illness, and anyone with children knows that, they're going to bring things home and you're going to have a bout of a GI illness. That's a good time to replenish and take a probiotic to try to help prevent that.
Do you have to be on it for a length of time for it to be effective, or can you just take it for a couple of days?
So sometimes they've talked about taking it, and we are looking at timing and what's the optimal time. And, people always ask me, especially my IBS patients, what, I feel like it does regulate my bowels. Should I take it forever? And honestly, we don't completely know that answer. I can tell you in the instance of, say, a bacterial enteritis, you want to take it for at least 4 weeks. And there are certain conditions where we'll use it where, yes, we can time it. If you're taking antibiotics where it's actually killing off your good bacteria, taking it within 2 days of starting that antibiotic and continuing it for 7 days beyond the last day of the dose has also been shown to be beneficial in studies. And then I just don't think they followed people out to, they're not going to follow people out for months and years. So if someone tells me, look, it helps me stay regular, I'm not going to tell you not to take it. Is there a benefit? I'm not sure if that's helping, but it's not harming. So in those instances, sometimes I'll say you can take it for an extended period, but there's truly no study, and I don't know if Christy, you've seen it, that I know of where there's a condition where they say take it forever.
No, because honestly, too, I think the research down to the specific strands is really just starting to take off. So it's really too early to tell. There's not enough research out there. Other than that, other conditions, some people with non-alcoholic fatty liver disease, probiotics, I have seen it help that relieve some of their symptoms with that as well. I don't know what you've seen, but that's another group that I've noticed has helped some of their GI symptoms.
Yes, very true.
Okay, it's very helpful. Let's move into sort of when do we know we should see a GI or a gastroenterologist, because I think most of us manage these symptoms on our own. And I think you had said more than a month, or I know I've read, I've even written about it for work, it changes in bowel habits, but I'm still not entirely sure that everyone understands what that means, because it's different for different people. So when you say more than a month, that doesn't mean you haven't had a bowel movement in a month, does it?
No. If your pattern has changed. So again, like you said, the bowels, when we look at normal is a vast spectrum. So, normal is a bowel movement, every 3 days to 3 times a day. But again, it's what your normal is. So if you're someone who goes once a day, like clockwork, I have my cup of coffee, I'm in the bathroom, I go start my day, I don't hit the bathroom again. That's your normal. If you deviate from that and it's a consistent finding, then yes, that might be something we need to investigate. seeing blood in your stools is always something that should be investigated. Again, we usually chalk it up to, oh, it's probably a hemorrhoid because they're so common. But blood sometimes is a warning sign that something more significant is going on. Having trouble swallowing or getting food down, or just symptoms that are not typical for you, developing nausea. And again, like I said, sometimes those things are more common in women, but it may be a symptom of something. You should not be nauseous just because your stomach empty is slower than an average male. So some of those things are alarm symptoms. Losing weight, being told you're anemic when you're getting your routine labs, they're warning signs.
How about the new recommendations for colonoscopy? I gotta tell you, it's not as bad as I thought it was going to be. I got my first one. I actually was pleasantly surprised how much easier the process was.
There are some perks to the colonoscopy. And yeah, I'm not sure if people are really aware that they did change the guidelines over the last year. Because as I said before, we're seeing more advanced polyps and more advanced tumors and even colon cancer in younger patients. And in studies, the rate is pretty impressive. We have talked about, and we've actually moved towards starting at a younger age. Now, naturally, if there's a family history, we do it even sooner. But if no risk factors, no family history, no underlying symptoms, 45 years old is when we start. If you have symptoms, that will prompt or may prompt a colonoscopy at an earlier age. Absolutely. And if there's a family history, the guidelines usually state that we do the colonoscopy 10 years prior to the family member's diagnosis or at age 40, whichever comes sooner.
Yeah, I think a lot of people think that's later in life, like 50, 60, and that's not the case anymore. You should have your colonoscopy at 45, or like you said, even potentially sooner.
Yes, right. So 40 to 45, or if you're having some of those alarm symptoms, is sooner than that.
Steve, you're going to add something there? I'm sorry, I thought you were getting ready to say something and I cut you off. And there's some great tips on the Virtua website about making the colonoscopy prep even easier. I highly recommend that article on virtua.org because it gave me great advice about even like 2-3 days ahead of time adjusting my diet so that the prep was just that much easier.
And I think the prep is what shies people away. It's hearing those horror stories of what people describe or what got passed down the line. Oh, I watched my mother or father go through it and it just seemed awful what they had to drink. There are newer preps out on the market that are lower volume or even pill preparations, which as long as there's no medical contraindication to that we can use that actually make it a little easier. Now, I'm not going to lie, you're going to have a night of diarrhea, but that's the key to be able to see in the colon. And quite honestly, there are celebrities that pay a lot of money to do colon cleanses, and this is your colon freebie cleanse.
I agree. I was like, this is like a cleanse. And it's just my own little bit of advice. I don't like Gatorade at all. I feel very nauseous when I drink Gatorade. And that's typically, I think the recommendation is it Miralax and Gatorade, but I was able to mix it with some other liquids and had my vitamin water and my electrolyte water, and it was fine. So I think it's a lot more flexible than it used to be.
Yes. And it's the best sleep of your life. So it'll make up for the time you were up using the bathroom.
Yes, I agree. Best sleep of your life, and you feel completely cleaned out and ready to start the next day.
It like kick-started my healthy eating. So yeah. Look, we're all like, go get your colonoscopy. Well, we have been getting some great questions from our attendees while we've been talking. So let me kind of jump into a few of those because this has just been really, I think, great information for everyone. I think it's important to remember that you gotta talk to your doctor about these issues, right? You guys hear it all. All right, so this first one is, I've been vegan for 14 years. How can someone who eats so many beans improve motility when many of the foods we eat move through very slowly? Christy, any thoughts on that one?
Again, just assessing your hydration, exercising, it could be physical exercise like walking, jogging, running. It could be, but you want to have a regular exercise routine as well. And even exercises like yoga. There's lots of different positions that will stretch things out, release your tension in your body that can help as well. So that can definitely help cope. But do your best to make exercise a regular a part of your routine. Some people say, oh, it's cold outside, or I'm a woman, I don't want to walk at night by myself. That's fine. Okay, put on some music, have a little dance party in the house, but do something at least 30 minutes, at minimum 3 times a week if you can't do something every day. And then just like we said, okay, yeah, you got the beans, but then making sure they're good fiber, but you might even need, that's your body's norm. So sometimes you need to shake things up a little bit. Like I said, maybe implement, okay, a little less beans one day, add a little bit of the ground flaxseed. Different things you can try.
What about chia seeds, right? So flaxseed, there's also chia seeds. Are those also helpful?
Chia seeds are also a great source of fiber. Just be careful if you have any history of any diverticular disease. Just run that by your GI doctor too, based upon what they find when they go in.
Yeah, avoid chia seeds the week before the colonoscopy. Absolutely.
I ate like white bread, crackers, white pasta, all the stuff I typically completely avoid. I was like 2-3 days before, I was just all like easy to digest, like loving all of the white carbs.
Yeah.
It's another benefit. Okay, this question is rather specific, but I think very interesting. So it says, when I have IBS diarrhea predominant, literally while eating in the bathroom, been to doctors and don't absorb B12, would consulting a dietitian be beneficial? Even when eating the healthiest food, still causes gas and diarrhea one day, and another day I'm okay with that food.
Yes, I think you want to do a multi-provider approach to that for sure, because the doctor is the one who can prescribe things as well as write orders for your blood tests. So we need to monitor your tests. There's also different forms of B12 you can get. So you can get your traditional B12, you can get a sublingual, you can get B12 injections if that's the problem. If you have any shortened intestines, you might need to get a different form of that. There are different vitamins out there that make a water-soluble fat vitamin. So even though your question is very specific, having that multi-approach to making sure that we go over foods that are rich in B12, such as your whole grains. And then if you're having a problem absorbing it, then we can help identify if oral doesn't work, if it's chewable or a capsule, maybe try sublingual, and then we'll talk to the doctor, and that would be interdisciplinary communication. Maybe you do need injections.
And then also alluding to that is sometimes if there are specific nutrients, knowing exactly where they're absorbed in the GI tract, we may need to focus on ruling out that maybe the diarrhea is caused by an inflammatory condition within the small intestine, and that's the problem. And making sure that you get an appropriate workup, medical workup is really important there too, just to make sure there's not any type of condition. Because again, small intestinal bacteria overgrowth is associated with a low B12 level, and sometimes patients are thinking, no, I have IBS, and it's actually not IBS, it's something else. Or like I said, inflammatory bowel disease can do that too. So really important to just, and that's where, as Christy said, it's a coordinated effort, making sure there's nothing going on that might be triggering that and your symptoms.
Well, and I think that's a really excellent point. And I've heard this from some friends as well about finding a doctor who's going to listen to you, who's going to work with you. If you're not getting those answers, it makes a big difference finding a gastroenterologist who's really willing to talk about the nutrition and not just the medication, and really keep digging until you're finding that right mix, right, to solve those issues.
Yep. Yeah, I know when the GI doctors refer patients to us, when they come in, I have the note printed right here. I see what they said, I see what they want us to work on, and then I hear what the patient says, and we talk. You're a huge part of the this too, your healthcare. You're a huge player in your healthcare. So together through nutrition, you and your input and the physician is what it takes to help solve your problems.
Yeah. How about GERD, right? That's that reflux and heartburn. Is there a diet that's recommended for someone with those issues?
Yeah, definitely there is. So avoiding certain things like that can trigger it, such as spicy foods, caffeine, peppermint, not eating too close to bedtime, even potentially sleeping with your head of your bed elevated, but definitely we can work on specific foods. Spicy foods tend to be the issue, or anything very acidic. In addition with, like I said, the peppermint as well. Limiting fatty foods can also help some.
And there's also health risks associated, right, with chronic GERD? Is that?
Yes, so chronic GERD has been shown to accelerate certain underlying conditions. So Barrett's esophagus is one we know that's actually a pre-cancerous condition. It can cause esophageal cancer. So requires, a genetic predisposition to it, but also the trigger to stimulate that cellular change to start to induce it is reflux. So yes, and that's why sometimes we talk about those alarm symptoms, that you have reflux that you can't control, that's keeping you up in the middle of the night, that is starting to cause trouble swallowing. It's really important to get that worked out.
Right. So not just diet changes, but it may be time to see a specialist.
Right.
Okay. Let's see, just some more questions here. Do I have to start a food journal to figure out why my stomach gets so bad? If so, how long do I have to keep a food journal? And what if I can't determine the trigger? This person's feeling very overwhelmed.
So as far as that, definitely I do recommend at least doing 3 days before you come in and see a dietitian. With that said, yes, it can be very hard. That's why you're not alone. We're here to help you. So I encourage not just keeping a list, a food diary, and there's different apps out there that you can utilize, or you can just do pen and paper. But whatever method you choose, then you need to have your system. Okay, circle that day on the calendar, star that day, write a number 3 if it's really bad. So if we see, okay, every Friday it's really bad, then we can take a look. If you're doing a food diary for a little longer, we can do a deep dive. Is there a common food in common that you're eating every Friday? So trends definitely help, as well as your system trackers, and then not rolling out, okay, what else is going on in your life? Is it stress? Is it that time of the month? Is it hormonal things going on? So it can be very frustrating. So that's why seek help. You're not alone to figure out what's going on. We're here to help.
So 3 days minimum, but really.
Yes. And then we'll talk about the steps going forward. If your GI doctor is able to find out potential causes, that can help provide insight as well. And then I can guide you towards a diet based on whatever condition you may have, or just as we sit down together and talk about your symptoms, when do they occur? What time of day do they occur? How far after eating? These are all key factors that we need to know to kind of pinpoint when, where, how, exactly what's involved, and then make sure too that there's not anything else that we're overlooking.
So more than just what you're eating, but then what's happening to you and how soon after eating.
Correct, and the frequency.
Yeah. And sometimes I know people will say, look, I don't see a pattern. I look at it. But again, that's where Christy comes in, because sometimes you might not realize that certain foods are directly associated with each other. And the other thing, I know people don't, it's hard to do 3 days in a row, but sometimes it's like, well, if you get the symptoms, so, I am doubled over in pain. It's easier to recall after, right immediately after. So then, yes, that might be an easier way to see the trigger. Because then right then and there, that was a severe flare of your symptoms.
We do have just a couple more questions that I would love to get to. This one is about leaky gut syndrome. I hear this, I think there's probably some advertisements for some pharmaceuticals for it. So what is leaky gut syndrome, and is there anything that can be done to fix it?
So then I think that alludes to like what we talked about is the microbiome of the GI tract. Is it healthy? Are the cells together and with tight junctions? Because the idea is when the cell's integrity starts to break down, whether it's from a food sensitivity or something that might be a direct irritant, whether it's a lack of bacteria, the thought is that maybe those junctions aren't as tight, and then pathogenic bacteria could actually translocate or cause inflammatory mediators to start to wreak havoc intracellularly and cause inflammation. So that is the phenomenon of leaky gut. I know there's a lot of literature, some people say it's not a real phenomenon, and some people say there's, it is, and studies have shown. And I think it does have a role to some degree, but I think we have to have a clear understanding of what that is. I mean, I don't think things are just going to leak into cells, but they are just going to start to cause cellular inflammation. It's going to kickstart some channels that might kickstart cascades of inflammation. And that's where they talk about, now, is there one telltale medication that's just going to treat leaky gut? No. Again, I think it's that dynamic of overall GI health and focusing on that microbiome and making sure we have a healthy environment so that we're not feeling those symptoms as a sign of, yes, there's inflammation going on.
Great.
I hope
what
that
about
answers.
the food sensitivity tests? I'm seeing those advertised now, and you can pick them up at the drugstore. Yay or nay? Do you find that that's helpful when someone comes in with that, or do you think that's just misleading?
So I think in some ways it is misleading. I'm still out on that right now. I know because people are leaning towards allergy testing and food sensitivities, and quite honestly, a food might be a trigger and you're not necessarily intolerant to it. So, and that's that phenomenon of everybody saying, oh, I'm gluten intolerant, or I'm gluten insensitive, or I have celiac disease. That's one common one that we hear about in lactose. But yeah, I think our bodies react to different foods for different ways because of their chemical makeup. So I might not be insensitive to something on the FODMAP diet, but it still gives me a reaction because of its makeup and how it's interacting with my microbiome. So I think hanging our hat on, oh, I'm sensitive to this, so I'm going to eliminate that, and that's going to be the cure, is not always the answer, which is why I'm not totally dependent on those panels.
Mm-hmm. Okay.
Yeah, and I agree. I've had some patients bring them in and they're like, oh, I'm a number 3, which 3 on this particular scale is listed as the worst one. So they're like, I'm number 3 for all these foods, but I eat those foods and I'm fine. So just because you may trigger, it doesn't mean that you are particularly GI-wise sensitive to that food at that particular time. And then it's balanced, or maybe you can have a small amount, but a larger amount is not good. So it can be a little confusing. It is not an allergy test. A lot of people come in and think, oh, they can't ever have anything listed on there. No, it's back to finding the right balance.
Right. So better to connect with each of you to help get to the bottom of, or the root cause. It's tempting though when they're staring at you at CVS.
Yeah. And when you're frustrated with symptoms and you don't know what to do, it's definitely tempting. And not that saying it's completely not useful. It can be helpful, but you have to know that that's not the end all be all.
Right. Well, we are just about, actually, we're a little over time, but I appreciate everyone that has stayed on with us because I think the conversation has been really helpful. I do have one here that was really specific, and I don't think we're going to have enough time to get to it, but we might be able to follow up with this person offline about MTHFR, a mutation that affects nutritional needs. So I think that one is a really interesting one. So if we want to just maybe our Dina or Nina in the background can connect with that person, we can get an email address and help it answer that question, because I think that's an important one. So thank you everyone so much. Is there any final words of wisdom before we wrap everything up, other than get your colonoscopy? Is there an age when you don't need to keep getting it? If you should start by 45, is there an age when you can stop?
Good question, and we are looking into that. The general number that they decided on many years ago was 74 to 75. But again, I think that was when life expectancy was much lower. I think people are living longer. I think medical advances and focusing on being healthier is actually, helping us live longer. So the key to colonoscopy is that if it's going to impact you, if the benefits outweigh the risks. So if we are preventing colon cancer, then, and your life expectancy is for many more years because you don't have significant heart disease or stroke or you're debilitated. Yes, I think age is just a number at times. We don't necessarily screen beyond a certain age if there are other issues going on. So again, I think that's something you should see your doctor and discuss it with your gastroenterologist.
All right. Well, I think my takeaway is remember that your doctor has heard it all. So speak up when something is not right. Just a reminder that a recording of our session will be available along with some very helpful links about digestive health services at Virtua, and that will be emailed to you in the next week. Virtua GI and Digestive Health actually has 20 office locations with over 50 gastroenterologists throughout South Jersey. Dr. DiSandro specifically sees patients in Cherry Hill, and her office is on Route 70. So if you want more information or to schedule an appointment, you can visit virtua.org/digestivehealth. And then for personalized approach to nutrition, you can schedule an appointment with Christy or one of our registered dietitians by visiting virtua.org/medical nutrition therapy. You can always call 888-VIRTUA-3 as well to connect with our experts and schedule an appointment. So thank you for joining us for another terrific Real Talk Virtua Women's Health Chat. These are always so educational and informative. Thank you, Dr. Theresa DiSandro. Thank you, Christy Davidson, for joining us. And we will see you soon.
Thank you for having me.
Thank you.
Thank you. Good night.
Good night.